we good?
Yeah.
Hi everybody, thanks for joining us. We're on Facebook Live and Instagram. My name is Jennifer Henne. I'm a registered nurse here at Columbus Aesthetic and Plastic Surgery. I'm also the hair restoration specialist here. I'm here with one of my favorite patients, Dan. He's a hair restoration patient of mine who's had an awesome journey with us. So we brought him along just to kind of help explain his journey and what he's been through, kind of give you a different perspective on things. We're going to wait a little bit here to let some people kind of join in and give them a little bit of time. Dan, why don't we start with you kind of letting us know a little bit about you, what you do for a living, and how you found us here at CAPS.
I am a handyman remodeler in the greater Columbus area, and I think I found you on the internet.
Yeah, Google.
So, yeah. So.
What was it about us that brought you into the office?
I think just the size.
Yeah.
There's, I don't know how many doctors here, so I guess it just
5 board certified plastic
more,
surgeons.
Choice, I guess.
Yeah.
So.
Yeah, different options.
Yeah.
Yeah, good, awesome. So we'll give it a little bit more time for some people to join us. Again, my name is Jennifer Henne, registered nurse here at Columbus Aesthetic and Plastic Surgery, hair restoration specialist. A little background on me: I've been a registered nurse for a little over 5 years. I've been here with CAPS for a little bit over 3 years. Dr. Angelos and myself started the hair restoration program a little over 3 years ago. We created it together, we built it together. He decided to kind of take a step back and focus on surgery, so the hair restoration program is now my baby. It's something that I really enjoy and something I'm really passionate about, because men and women, I think 8 million, yeah, 8 million men and women, 80 million men and women suffer from hair loss. So it's not just men coming in to get hair restoration or hair transplants, but it's actually, I would probably say 60 to 70% of my clientele is a lot of women. There's a lot of women that come in. As we know, women deal with stress. We deal with stress. We deal with families, kind of balancing everything from day-to-day life. So a lot of women come in for the hair loss as well. So today we'll be talking about PRP injections for the scalp, so maintenance therapy, and then we'll also be talking about the hair transplants as well. So this is going to be for men and women, any age and at any stage of your hair thinning or hair loss journey. So a little bit about what brings people in. So a lot of people start from, if you're noticing a little bit of thinning, a lot of people want to kind of come in and figure out, well, what can I do to prolong my hair thinning, or what can I do to prevent my hair from thinning anymore? So we'll start with the PRP and the light therapy treatments for this. PRP is short for platelet-rich plasma. So if you're unfamiliar with what platelet-rich plasma is, it is all the healthy proteins, growth factors, all the good stuff in your blood cells that are used for healing. So, also, I'm sorry, I completely forgot. If you guys have any questions during, go ahead and ask. You don't have to wait till the end. I'm going to do my best to read the questions as they come in, and I'll answer them as you guys are listening. So PRP, platelet-rich plasma, protein, healthy growth factors in your blood. Basically, if you get a cut in your arm, the PRP is what instantly goes to that cut to start healing it. So what I do is I draw your blood, spin it down into the PRP so it separates into the PRP, and then I inject it into the scalp. Why I'm doing this is because as we age, as we get older, stress, we get decreased blood flow or blood loss, everywhere in our body, including our scalp. So we start losing hair in our scalp. We carry anywhere from 1 to 4 hair shafts per hair follicle. So when we get decreased blood flow to those hair follicles, we start losing hair shafts. So we'll have 4 hair shafts down to 3, down to 2, down to 1. And then when we lose that last hair shaft, that hair follicle completely dies. So what the PRP does is, I draw it from the blood, spin it down, and then inject it into the scalp. So when I'm injecting your PRP into the scalp, It is bringing all of this new healthy blood flow to this area. All of these growth factors, all of these proteins are feeding into the hair follicles. So basically think of it as nutrients to the soil. So your hair follicle is going to be the seed in the soil, and then the PRP is going to be the nutrients that are feeding the soil, keeping the hair follicle active, keeping it alive, and keeping it healthy. How often do we have to get PRP injections? So studies show that PRP lasts anywhere from 9 to 12 months, but to be completely honest, I think that PRP lasts from my experience with my patients, about 6 to 9 months. So I typically recommend an injection anywhere from 1 to 4 times a year. Quarterly would be perfect. I would recommend a quarterly injection, once a quarter, for best results. But once a year is okay, but 4 times a year would be perfect. And then light therapy. So if you're unfamiliar with red light therapy, red light is basically acts as an incubator to your hair follicles. So pretty much in between your PRP injections, you're going to either come in for red light therapy, or you're going to buy your own red light cap at home and do the red light therapy anywhere from 1 to 4 times a week, kind of depending on where you're at in your hair loss journey. So basically what the red light therapy does is takes the PRP, kind of takes it to the next step, takes it to the next level. I kind of explain it as like icing on the cake for your PRP. So in between your appointments with me, you'll do the red light therapy. It acts like an incubator to the hair follicles, kind of stimulating it, help bringing blood flow to that area. So that's PRP in a little nutshell. And then the next step, so depending on where you are in your hair thinning journey, neograft or the FUE, the follicular unit extraction technique, is a really good treatment for actually growing hair. So what we do is we transplant hair to give you real hair growth. The PRP is good for maintaining your hair, for kind of prolonging your hair thinning journey, but the neograft is really good for giving you new hair. So Dan here had the neograft procedure. I'll go into a little bit about what neograft is, kind of what you can expect from before, during, and after, and then Dan will tell us about his journey.
Before we go on to Dan, we do have a question. How much blood needs to be drawn for PRP?
Oh, that's a really good question. So for PRP, we typically draw about 30 milliliters of blood, and then we spin it down to about 5 to 6 milliliters of PRP, depending on the area that we're treating. So it's really not that much. Yeah, good question. Do we have any more questions? No. Good. So neograft. Neograft is basically the name of the machine that we use for the hair transplant. The name of the actual technique is FUE. It's follicular unit extraction. So what we're doing is we're extracting each follicle one by one. A lot of people are really familiar with the strip technique. The strip technique is what they used back in the day, where they excise an actual strip of your scalp, and then that'll leave a scar because they're excising it and suturing it, leaves a scar on the back of the scalp. The FUE technique is actually really good because it is scarless, it's non-invasive, so the healing time, the downtime, everything that comes along with it is actually a lot more beneficial today because everyone is working. No one can take 2-3 weeks off of work, so the FUE technique is actually really good for healing. And a lot of people don't want to tell anyone that they had this done, so this is actually perfect for being discreet. Dan is obviously not discreet, but I appreciate you coming here with us today. So the FUE, so what we do is, and this can be good for anyone in their hair loss journey. It can be good for anyone that is starting to thin in their peak area here, starting to kind of go back in their hairline here, or the crown area is crown area for men is actually the #1 concern, but a lot of people don't see that crown area. So a lot of people don't focus on that until someone brings it up, and then that's typically what brings them in the office. But the hairline and the peak is really popular as well. So what we do with the FUE technique is We extract from back here, each follicle one by one, and then we transplant on top of the head in the area of the main concern. The reason why we extract from back here is because you never lose these, actually, so hormones are what affect hair loss, right? So your hormones are not affected with the hairs back here. So if you see the baldest guy walking around, he always has that strip back here, right? Yeah, never any hair on top, but always that strip back here. So we pull from back here, it's not affected by hormones. So the hair that we pull from back here and transplant on top of the scalp, you will take to the grave with you. You will never lose that hair. So the neograft, the FUE technique, it is an investment, but that hair you will take with you to the grave. So we pull from back here, one by one. We can do up to 2,500 grafts at a time. We can do as little as 500 or as much as 2,500. It kind of just depends on where you're at. So we pull from back here, one by one, and then we transplant on top of here. You're here for about 8 hours. It's about an 8-hour procedure. It's a long day, is it not? Yeah, but it goes by quick, right?
It
Yeah.
does.
So you're awake for the entire thing. So we'll medicate you. We'll give you some anti-anxiety and some pain medication to relax you for the day. We inject your scalp with numbing injections, so your scalp is numb. And then for the first half of the morning, you're lying face down. We're doing all the extractions back here. And then we break for lunch, provide you lunch, kind of give you a little second to kind of recoup, and then give you some more medication. And then the second half of the day, you're lying face up, and then we're doing all of the actual transplants. And then after that, it's pretty much an easy recovery. How much time did you take off of work? Actually, you didn't take that much time off, did you? No.
A couple days.
Yeah. So ideally, we'd love for you to take probably about 7 days off of work, because the first 3 to 5 days that you are recovering after the procedure, we kind of have to baby those grafts, right? So
Yeah.
they scab the first 24 hours.
And your face blows up.
Blows up in what way? A little swollen.
A little swelling.
You're a little swollen.
No,
Not
well,
too bad though,
yeah,
right?
No, that's more than I think the concern.
Yeah, the swelling.
Yeah.
Okay. So we'll start with your journey then. You kind of let me. We'll start with. You already started with what brought you here. You found us on Google. You liked, what you read about us. Came into the
I
office.
started seeing less and less hair in every picture that I saw. It was just, and mainly just
Of yourself?
my my front hairline just disappearing.
How long did you notice that going for?
I mean, it's gradual, so you don't really pay attention to it until you just see pictures.
One
and
day
see
just, hits you in the face.
You have no more hair to flip in the front, so it's it thins and thins and thins.
So were you, okay, I'm sorry, let's go back. So we did 2,500 grafts for Dan here, and you're about 10 months out from your procedure. Were you able to wear your hair like this before?
Not really, because there wasn't enough hair in the hairline to get it that way. So I just basically either wore a hat or just let it fly.
Kind of just embraced it?
Yes.
Yeah, it was a little colder.
So,
Yeah, without hair there. Good. How long has it been a concern of yours?
maybe a couple of years.
Yeah.
So
Okay.
just I guess when it got bad is when
Decided to do something about it. So what made you want to do the FUE, the follicular unit extraction technique, versus the strip? Did you look into the strip technique at all?
Not really. That just seemed, I've seen other people that have done that, and
Yeah,
I
the
saw,
scar. You see
yeah,
the scar, it's
yeah.
noticeable. You can't wear your hair short
yeah.
on the back.
And there's always, they have long hair in the back to cover things up, so
Yeah.
I just didn't want to deal
And you
with
wear
it.
your hair pretty
So,
short.
yeah.
That's good. Okay, so let's start with then the day. So the day of, you you come in about 7 a.m. You spend about 7 hours with us. When you came in and we first started with the numbing injections, how was that?
The first part of the day is easier. It was very interesting to, they basically just use a little drill, and there's,
So it's kind of like a hole punch.
right,
Yep.
and you just hear this drilling sound and this suction sound. This is when the hair follicle gets sucked up into the little.
But everything was numb, right?
Yes, no,
Everything
there was no-
numb. Did you
it
feel
was
like a tiny little pressure?
a little bit of pressure,
You're
and that
pretty
was about
relaxed
it.
on your medication though, right?
Yeah. And it was just, it wasn't bad at all.
Okay.
So
So a few hours went by really quick, right?
It did.
Yeah. So the
I
first
think
half
I
of the
might
morning.
have fallen asleep a couple times.
Yeah. Oh, of course. Everyone falls asleep. Yeah. We just relax the whole time.
So, yeah.
So the first half of the morning we were doing the extractions. So we extract the hair follicles one by one. So each hair follicle has anywhere from 1 to 4 hair shafts per hair follicle. So what we do is we extract the hair follicles one by one. We have 1s, 2s, 3s, and 4s depending on how many hair shafts per hair follicle you had. So then we separate those all morning while we're doing the extractions. It's like a vacuum hole punch. So we're hole punching and then extracting the hair follicle, and then we're separating it. So we did that first half of the morning, and then we took a break for lunch, provided you lunch, got to give you a little break. Redose you on some medication so that you're able to survive the second half of the day. But it really, I mean, really isn't that bad though, right? It's not like you're surviving or like trying to get through it.
No, the second half's a little rougher than the first.
Was it?
Yeah.
Why?
When they're making the holes to put the...
Making the graft sites.
Yes.
Okay, so second half of the day, we're making the graft sites. Basically, we're making all of the tiny little puncture sites where we are putting those actual hair follicles. So a little bit of pain, but pressure.
Yeah.
How about some pressure, not pain, right?
And when they were putting them in, it was nothing, and I think I fell asleep again.
Yeah, I think you did too. Took a little nap.
Yes.
Had a good day off. So we make all the puncture sites where we're going to put the grafts, and then 2,500 tiny little hair follicles, we put those in those puncture sites, and then bandage you up with a little pressure dressing and send you on your way.
Yes.
So the first few hours after that, the numbing wears off. You're kind of relaxing for the night. We send you home with some pain medication, but really you're not really in a lot of pain or discomfort.
No.
It's kind of just annoying, right?
Yeah.
Yeah.
Itchy.
Yeah.
Maybe a little bit.
Itchy. Yeah.
But having to... I sleep laying on my stomach and then having to sleep.
Yep. So you have
Basically
to sleep,
sitting
yeah.
up is, you know...
So basically what we have to do is pretty much baby those hair follicles for the first 3 to 5 days. So we really want them to take place. We don't want to do anything cause any pressure or anything that might cause those hair follicles to dislodge, right? So you have to sleep on your back, propped up on a few pillows. Make sure that you're not sleeping on your stomach or on your side, doing anything that can cause those hair follicles to kind of dislodge and move out of place.
I got the airline pillow.
Oh, yep.
To help.
So an airplane pillow, kind of keep your head straight while you're sleeping, so you're not turning on your back or I'm sorry, your side or your stomach or anything. So you wear the pressure dressing for about 48 hours, 2 days. That's probably the most annoying part. And then after you wear that for 2 days, you can take it off and shower, wash your hair for the first time. You can wear a hat after that, so really after the first 48 hours, if you need to go out in public, if you need to make a few meetings or anything like that, you can wear a hat, not a ball cap, but just something that can lightly go over the scalp there. So, and I think I don't recommend going back to work until at least like 7 days, but if you can work from home, that's perfect. But really your only restrictions are no lifting anything over 10 pounds. How long does no surgery? I don't know. How long does no surgery take to recover from?
We can definitely look that up and get
We'll
back
let
to
you
them.
know, Mary Beth. Kayla.
I didn't have it done.
No?
It's natural.
It looks like it. It looks like it though. You got a great nose. That'll be the next one. Actually, we could do that next.
Yes.
Not me, but you guys. So yeah, 48 hours you can wear a ball cap. Your only restrictions, no lifting anything over 10 pounds for 7 to 10 days, no working out for 7 to 10 days, no bending your head below your heart for the first week, and when you're taking a shower, you just can't have the pressure of the shower head directly on your scalp. We just don't want to do anything to cause pressure in the scalp area to dislodge a graft. But basically, you're really just laying low for the first week. You don't feel like you had anything done at all. You don't feel like you had a full procedure done. You kind of look like you did because you have these scabs on top of your scalp. But other than that, you actually feel really good, right? So
Well, the temptation to pull those off is...
yeah, so they're scabs, so you have to spray them, you have to keep them moist, you have to make sure that you're just taking care of them, you keep spraying them, and they fall out after about like 7 to 10 days. You can go back to work if you want to. If you're not worried about being discreet or anything, that's totally fine. But we just don't want to do anything to cause pressure in that area. So scabs fall out after about 7 to 10 days. After those 7 to 10 days, when the scabs fall off, you're pretty much good to go. You can go back to your daily activity, your daily routine, go back to working out. You can get your hair cut at that time if you need anything touched up from the procedure. Pretty much back to normal after about a week. So the downtime really isn't anything that's too extreme where you feel like you had anything done. It's just really having those scabs on top of your scalp, hiding from the outside world if you don't want anyone to know for that first week. But after those scabs fall out, you're pretty much good to go. How long did it take you for your scabs to fall out?
I don't remember.
No.
It's been 10 months.
That's true. Okay, it has been a while. So when do we start seeing that hair grow? So after it's about 4 to 6 months, you start noticing that hair to come in nice and slow. So the hair, it's been through a lot. The scalp has been traumatized through this procedure. So the hair follicles pretty much stay dormant for about 4 to 6 months, and then they start to pop through the scalp and you start to see these tiny little baby hairs growing. So I think I saw you at your 6-month follow-up, and we definitely noticed the hair coming in. But when was it? Actually, you told me a really great story about at the doctor's office. Tell me about the story.
I went for my
you
annual,
told me like 2 weeks ago.
In October, my annual physical, and nurse practitioner came in, and she starts going through, have you had anything done this year? And I said, well, yeah, I had some hair moved around.
Wait, no, this is not the story you told me.
Yeah, this is the story I told you.
Okay, but she noticed something before you said
She
anything.
didn't notice.
Oh, the other girl did.
The actual nurse that came in before and took my blood pressure and all that fun stuff. And when the practitioner came in, she would start asking me, have you had anything done? I said, well, yes. And she said, and I told her that I had some hair moved around, and she goes, the nurse said something there's different about you, and she couldn't put her finger on it.
Yes,
So,
I love
and
that.
at the end, she did ask, she goes, well, can I tell her that you got your hair done? I'm like, yes.
Yeah,
Because
of
I
course.
didn't tell people just to see if, there was a result. So
Yeah.
I could be like, was
If
this
there
worth...
was a result.
Right, yeah, and are people going to notice, or are they not? So I wasn't really telling people just to see their reaction. And I'm going home for Christmas and seeing my mother.
Oh,
And
so we'll have to do a
So
follow-up.
we'll have to see if she notices.
You didn't
but
tell your mom?
No.
No, you didn't tell anyone in your family.
No, I didn't tell
Do they
anybody.
have Instagram?
I told a couple of friends, and they told everybody they knew. But
Oh, really?
oh yeah.
Oh, good for nothing.
So I purposely just to tell people to see if people notice, but it's kind of like if you painted your ceiling an off color, are people going to notice, or are they just going to like, there's something different in the room?
Well, they don't know
it's
what
just,
it is.
Yeah.
That's actually perfect, 'cause that's actually what I tell every patient. So 4 to 6 months when you start noticing that hair growing in, and then 9 to 12 months for that full hair growth to come in, for you to really notice that thickness, right? So it sucks because it's a long waiting game, but it's also awesome because since it's over a year, a lot of people aren't going to notice. It's so slow progression.
Well, I didn't even really notice it.
Yeah, exactly.
Because it's just
and then when
not
you come
that big
in
of-
and
yeah.
we do your before
well,
and after
you see yourself every
photos.
day, so it's
Yeah.
just like I remember the smaller hairs, shorter hairs,
Coming
because
in.
you can see them because they're a lot shorter than the hairs around them. But
Yeah.
it's just so that's why I'm like looking for other people to notice, because I can tell there's more hair there, but it's not a dramatic change for me because I see it every day.
Right,
So,
exactly. But when we pulled up those before and after photos, you were kind of like, oh my gosh, there is hair there. Yeah, super excited.
We have a really good question
Yeah.
from Rachel. Does the area you take hair from look thinner after they are extracted and moved?
That's actually a really great question. So we only take about 15 to 20% of the hair from back here. The reason why we take 15 to 20% is because we don't want to leave you with less hair back there so that it's noticeable or more thin. I have turned away plenty of patients who didn't have enough hair back here for us to pull from, that if I did pull from back there, they would have been more thin and they would have been unhappy overall. So when you come in for a consultation, I do a full assessment. I look at the hair and make sure that you have plenty of hair back there to pull from, and then when we actually go in to pull the grafts, if when you know we're in there and we feel like we don't want to over harvest or over graft, we'll let you know, and we'll make sure that we leave you happy after the procedure, even if we have to take a few less grafts. But it's only 15 to 20%. You can go online, you can see our photos, or if you come in for a consultation, I'll show you pictures of what a patient looks like a week after, 2 weeks after, 6 months after, and a year after. Dan, actually, you want to show them the back of your scalp?
Yeah.
Yeah, okay, so we did 2,500 grafts, which is the most that we can do. Hold on, turn a little bit more. Yep, perfect. 2,500 grafts, the most that we can do. And I mean, you actually, so a lot of patients sometimes need 2 treatments. Dan, actually, he has enough hair back here that he could get away with another treatment in the future if he wanted, 5, 10, 15 years down the road. Looks very natural though. We always make sure we don't over harvest or over graft from back there, so it's a very natural procedure. There's no scar, there's no incisions being made at all. Someone said you look great.
Yeah, we've had
He's
several
single.
people say your hair looks great.
Yes, he is
Well,
single.
thank you.
Hit me up on Instagram. He doesn't have an Instagram, right?
No.
No, okay, so I'll be the communicator between the two. Just kidding. Anyways, so yeah, that's a great question. What were we talking about before that?
I don't know.
Okay, I don't remember either. Yeah, so 12 months. So a full year is when you will notice your main results. I bring you back in at 12 months, and then we go over your before and after photos. And then we kind of go from there. So PRP actually can work at this time as well. So the hair that I transplant, you will take to the grave with you. It's a lifetime investment. You will never lose that hair because that hair is not affected by hormones. So we pull from back here, transplant on top of here. We take all of that DNA with that hair follicle. So even though it's on top of your scalp, it's still not affected by hormones. It's hair that you will have with you forever, which is awesome. Unfortunately though, you're still going to have your native hair that you might lose. So I can't stop hair thinning. I can slow the progression down with PRP, but you have the native hair that you will still continue to lose over time depending on genetics, DNA, all that fun stuff, aging. So we can also do PRP at this time as well after your neograft procedure to kind of help maintain your native hair that you do have and prolong that hair thinning process as well.
Did he also have PRP after or use light therapy?
He did not. So he's 10 months out. I
do
typically
have home light therapy. That I remember.
okay, which light is it?
I can't remember.
Okay.
It's the big
Cap,
white
helmet.
space-looking helmet. Yeah.
Okay,
It's
yep.
not the. They have a ball cap one.
Yeah.
But I chose the
Yeah.
cheaper space helmet.
That's okay. So yes, he does use he does use a red light therapy at home, which is great for the native hair. You don't need to do anything for the transplanted hair, but the red light therapy is great for the native hair to kind of help bring blood flow to that area, to keep it alive, to keep it active, to help stimulate those hair follicles. That is something that you do have to use indefinitely, which is something we can talk about at your consultation if you do come in and see us.
But to answer your question, no PRP for me.
Yes, no PRP yet.
Yeah.
Typically when patients come in about a year out, we start talking about, okay, next steps. This is where we're at exactly at a year out. This is what your results are, and now what do we need to do from here? Some people want to get a second procedure done. You don't have to get it done at any time. It can be 5 years, 10 years, any point. But there's other things we can do. We have hair products here that we use. I love the Nioxin hair products. The PRP, so hair products and PRP are really good for maintaining. Obviously, we talk about collagen, the hair, skin, and nail vitamins, and then we can always talk about a second transplant if needed in the future, because you will continue to lose your native hair. I think you're looking really good right now, though. I'm really excited for you. Overall, how was your experience?
Very good.
Yeah?
Yeah.
Yeah? Would you do it again?
Yeah.
Yeah? It was pretty easy, right?
Mm.
It's really not that bad. Okay, what was the worst part of it? Be honest.
The needle going in the skull.
In the skull? It was not going
well,
in the skull.
on the top, whatever. It's weird. It's actually just kind of very,
Like when we were numbing?
No, just when they were actually,
making the sites.
Yes.
Okay.
Yeah,
So
that was-
just tiny little injection sites. That's it.
there
yeah.
you go. Yes,
Yeah. No
yes,
big deal.
yes.
Okay. So the recovery though, that
No,
wasn't
no,
the worst part. That was
no,
easy.
No, very good.
Perfect. And you only took a few days off of work because you can wear a hat to work, right?
Yeah.
Yeah. Good. Awesome. Okay. I think that's it. We'll see if anyone has any last minute questions. You can always come in to see me for a consultation. No matter where you are in your hair loss journey, if you're just noticing, if you're in the middle of it, or if you think you're too far gone, don't worry about it. Come in, come see me. I'm completely honest. We'll have an open conversation about it, and I'll let you know, if there's anything we can do to help. If there's nothing that we can do and I don't think you're a good candidate, I'll let you know that as well. Yeah, come in and see us, Columbus Aesthetic and Plastic Surgery. Jennifer Henne, RN, hair restoration specialist, and then one of my good patients here, Dan. If you guys have any questions, let us know. If not, you can call us, set up a consultation. Consultations are complimentary. You'll spend about an hour with me. Good
How much
question.
is a consultation?
Consultations are complimentary. So like I said, you'll spend an hour with me. I'll do my assessment. We'll talk over what your different options are. Depending on what we talked about, I'll give you a quote for pricing so you know exactly what to expect for your pricing for our plan. And then we kind of go from there.
How long is that quote good for? If somebody decides they don't want to book that day.
So the quote is good for a year. But, a lot can happen in a year. So let's say you come in and see me tomorrow and then you come back in next December. We'll kind of just go over our plan again, make sure everything's the same because, as you know, everyone loses hair at different times, loses different amount of hair depending on, lifestyle, aging, what you're going through. So always a complimentary consultation. Doesn't hurt to ask questions. Just come in, see me, we'll have a chat, and then figure out what's good for you. Cool. That was the same one. Awesome. Thanks, guys, so much. Good job.